My pain is basically from degenerative disc disease. I have about 5 discs that are involved in that, and then I have 2 bulging discs and 1 protruding disc. But at the same time, I had a busted hip and 2 bad knees from playing college football.
So trigger points actually often develop in patients who have chronic musculoskeletal syndrome disorders. It's also very common in patients who have repetitive work injuries or hobbies that require repetitive muscle contraction. Sometimes with acute trauma, you can also get irritation and stress on those muscles as well, so trigger points can develop in those situations.
When I met Dr. Rome, I mentioned the pain, and I told her it felt like a trigger point. But all the other people that I had talked to in the last year or so said that you don't have trigger points at that level. And she felt and said, you do have a trigger point here. And I said, thank God, that somebody finally has taken the time to listen to me. And I asked her, would she treat it? And she said, absolutely. And she went and got a syringe and injected it with painkiller. And I imagine at least 60% or more of my back pain that I had had for 5 years went away that day.
Well, one of the first things that I noticed about Ed is that he had some significant myofascial pain symptoms in his back. He had several trigger points that I noted in his lumbar paraspinal area, and we were going to go ahead and treat that with trigger point injections. Ed so far has received significant benefit from his first and second trigger point injections. We plan on following that up with a series of 2 or 3 more, and hopefully that will eliminate the myofascial problem. He also has some symptoms from his degenerative disc disease, and he's going to be following up in the CPS clinic for lumbar epidural steroid injections as well to help those symptoms.
I'm carrying out the trash, I'm mowing the grass. I don't have to carry this cane anymore to walk, and just thank the world of her for listening to me. My life has been changed since that day.